Each week on Friday, when John Cullen investigates, everybody says, John, why do you believe the CDC? And we have to go through this kind of each week to remind people that it's not a matter of believing the CDC. It's just an audit of their own information that our politicians and public health policymakers are themselves relying on. John, how are you today?
I'm very well, Jason. Thank you. How are you?
I'm doing great, and I'm glad to be here with you, about to start another show. We've got people who are watching here on Crowdsource the Truth 2, and of course on the simulcast on the John E. Hoover YouTube channel. I'm pleased that we have this as a resource. We've currently got 21 people joining us on John's channel. If you're not yet subscribed to the John E. Hoover YouTube channel, please go over there, check it out. John's got a lot of unique videos on there. Of course, each of our videos are simulcast, but John is producing usually several videos per week, so good reason for people to subscribe to his YouTube channel. John, I know you're aware of this, and we were talking with David Hawkins about it just briefly, well, I should say just a short while ago. The Jason Goodman YouTube channel that has 114,000 subscribers and helps us disseminate these videos to a large number of people. It's been struck by the president and CEO of the National Academy of Television Arts and Sciences, really big multi-million-dollar organization. They do the news Emmys, the documentary Emmys. Doesn't like the show, I guess.
Do they? I mean, is this the daytime Emmys and the Emmys, or just news Emmys? Is this the Emmys? This is like the whole Emmy operation?
Yeah, there's a whole complicated history where the West Coast division had a fight and they split, and there's all these different kind of like flavors of Emmys. But this guy, you know, he's the one in charge of news and documentary Emmys, I think daytime Emmys, a couple different of the Emmy shows. They claim that our Crony Awards show violated their copyright on, by using the image of the statue. I say it's a parody because we showed that Emmy statue, a parody of it, holding the coronavirus molecule or particle or whatever that thing is. And John, that show was about countries that were doing well at solving the coronavirus problem, wasn't it?
Indeed. We were acknowledging the countries that, despite their large populations, had relatively few people dead.
Right.
And so I'm not sure if they're confused and that they believe that we were trying to convince the world that we were the real Emmys. Right? Is that what they were afraid of, and that the audience would be confused?
A copyright violation. Like, in other words, if we were Howard Stern and we gave out the Emmys, awards for broadcasting on radio, that would seem like more of an abuse of the copyright on the name, misrepresenting. I would be confused as a listener. Is this actually affiliated with the Emmys? Howard Stern is certainly way more known than you or I, and he broadcasts on NBC. Maybe that's the difference. NBC somehow.
The funny thing is, from my perspective, you could have used a bowling trophy. I didn't. It didn't matter to me. It could have been a high school trophy for track and field. The idea is we were giving out awards. We weren't giving out Emmy awards. We were giving out Crony awards, coronavirus awards. The fact that you used a statue, again, it could have been a bowling statue. In fact, you probably next time let's use a bowling statue, because bowling doesn't get the respect that it deserves.
Right, bowling for dollars, perhaps. Well, it's going to be an interesting foray deeper into the legal world, because now there's a strike on the YouTube channel. The guy's gotten his lawyers involved. It's a whole big thing. And they're trying to shut us down. It's important for people who want to continue getting this information. Right now, John, the strike is in effect until November 18th if we're unable to arrive at an agreement with the people that have issued the strike. So people who want to continuously receive broadcasts should definitely get onto subscribestar.com and patreon.com/crowdsourcethetruth. And for our simulcast shows, they can also get them on subscribestar.com/IamJohnCullen and patreon.com/IamJohnCullen. I've said this a few times, but I need to reiterate it. I think the real reason this is happening, John, is that the powers that be that control commercial television production and broadcast, they like the model that they have in place, where the shows are free to the consumer, which creates a pretty substantial enticement for people to want to watch them. It doesn't cost anything. And they're paid for by corporate sponsors, advertisers who, they might argue, don't shape the content, but that is not true, because if you are supported by a sponsor and you do something that sponsor doesn't like or that you suspect they might not like, they're going to terminate the sponsorship and your show is over. So that's why we've relied on this system of direct-to-viewer sponsorship. And I'm not trying to sell, any products on here other than the show itself. So people who like the show can sponsor it, and they get a chance to see all this information without corporate overlords, including YouTube, telling them what they can or cannot see.
Well, I think that there might be a deeper reason here, which is that your channel, your Crowdsource the Truth broadcast, is starting to kind of threaten the traditional model, right? It's threatening that traditional television model, channel 2, channel 4, channel 7, right? That whole thing. And the fact that over the course of the last year, I mean, you've had Bernie Kerik on, you've had Judge Janine, right? Janine Pirro, right?
Yeah.
Right?
We've had Sidney Powell, we've had Dershowitz, we've had Matthew Whitaker, a lot of big names.
The guy from the White House, right? I mean, you've had some big names on the show, and I think that's a threat to them, because in the past there was no way these people were going to show on a podcast type format on YouTube, and yet lo and behold, you're breaking major news with Bernie Kerik, with Alan Dershowitz, with Judge Janine, with it's like week in, week out. You're breaking major aspects of these stories with major players, and I think that that's a threat to the status quo and to the guys who give out these Emmys. And I think it might be more about that than the damn thumbnail.
I think you're right.
Really,
I think you're right.
This is so.
We got a little delay on your VPN today. I think people know John is coming in from a very remote location, so we do the best that we can. When we transition over to the sponsor exclusive segment, we'll maybe try VPNing through someplace else and get a different thing going. But John, you've created another one of your presentations today. It's also important for people watching right now to realize that this is not John putting out theories, making up numbers, etc. We're just reviewing information that you're getting directly from public areas of the CDC website, right? What are we going to talk about tonight?
Yeah, indeed. I mean, the idea here is you can't come out of the gate and say I do or I don't trust the data until you review the data, right? So do I trust everything Dr. Fauci says? Absolutely not, right? So what I'm trying to do is audit the data, look for inconsistencies. And what we've been doing is looking for inconsistencies between the CDC and the states individually, right? So we saw states that stopped reporting, right? So remember, we saw New Jersey stop reporting. We saw New York pretended that it was going away, but they stopped reporting. And we went through that months ago, and we correlated that with what the CDC was saying and doing. And then the World Health Organization completely stopped reporting. So if you don't study the data the way we've been doing it, you can't back up your statement that the CDC's data is a bunch of nonsense, right? Because then the next question is going to be like, well, give me an example, right? So we have examples. That's the difference, right? So we're backing it up with data. And by doing that, that's what gives this argument credibility. And it's what makes it just entirely fact-based And there's no conspiracy theory here whatsoever. This is the CDC's data. It's the WHO's data. It's the state's data. And that's why my channel is still up on YouTube, because it's irrefutable.
Yeah.
It's their data, right? So I'm just putting it in the chart. And whoever it is that's fact checking, Southern Poverty Law Center, whoever at YouTube, I'm driving them crazy because it's all fact based. And the only video, by the way, that they took down that you and I have done over the course of the last 6 months is the 2 hour and 20-minute video, the podcast that we did with Shepard and Bellis. And that's the only one hold of mine from YouTube, right? So interesting. So all this other stuff, all the coronavirus stuff, all the influenza facts and figures, they can't pull it because it's CDC data. It's WHO data. It's on the money. It's fact-based. So why don't we dig in and let's take a look at where we stand nationwide in the United States, right? Where's the United States right now compared to what you're hearing in mainstream media? So I like to start with Drudge Report, not because I trust Drudge Report, but because as a news aggregator, it gives me the zeitgeist. It gives me a feel for what the hell's going on and what are people seeing that are going to Drudge Report. So it gives me a zeitgeist. I then go to Google News, news.google.com. And so you get a zeitgeist of what's happening and what's the gist. And are we talking about coronavirus? Are we not talking about coronavirus? And what is the gist of the conversation about coronavirus right now? And then where I like to go is the bottom of the page on Drudge Report. They have links to the maps. And it says worldwide map, not all the way to the bottom, above the writer's column. You got to go up a little bit more. And you'll see map, U.S. map and world map of virus. And I want to go to the U.S. And for those of you at home who are following our research, middle column.
Yeah. U.S.
America
deaths?
sick. America sick map.
Yep.
So that's Reuters. And I like to use this Reuters data sometimes just to correlate the data that we're getting from the Johns Hopkins map. So both of those links are at that bottom middle of Drudge Report. So for those of you who are watching and want to follow along, you go to Drudge Report, you go to the middle column, you go to the bottom. And what we're looking at now is the one that's talking about America. And then the other one, the Johns Hopkins, is the one that says worldwide. All right.
Salty Sphinx
if you go,
says Drudge Report sold out to CCP a while ago. Jack says Drudge Report smells.
Yeah. Drudge Report has changed, right? So it's no longer Drudge. So I think a George Soros-controlled company may have purchased it, but I can't be positive. Speaking of which, as you shift over, we don't need to stay in the browser because I got the snapshots already. I grabbed everything for you. So if you go over that PDF deck, I've got everything from here. I just want the audience to see where we're getting it from. So speaking of that, MGM Resorts, we had talked about a couple months ago when the pandemic was breaking out. And I think I said, I'm not a stock investor, right? I'm not a investment advisor. I'm not a fiduciary. But I felt that MGM was headed down and headed towards.
Wow.
Yeah. So MGM's laid off 18,000 people, which is spectacular. Now, remember, we talked about how they sold off their real estate to BlackRock or Blackstone or Black Ridge or one of the black companies. Yeah. BlackRock, right?
Or was it Blackstone?
So they sold off their real estate.
Which was it?
I don't remember. I was one of them. I don't know. That's why I was joking around because I don't remember. I know it's one of the black something. Salesforce.com laid off 1,000 people this week.
Whoa.
So that's me. Yeah, that's big. But 18,000 people is a major layoff, especially in the Las Vegas area.
Right.
So that's huge. And remember, the company, the control of the company now, it's controlled absolutely by George Soros led investment, right? So the lead investment in the company that owns MGM is owned by Soros. We reported that here on this show a couple months ago, but I thought this was notable. So, all right, let's hop back over to that PDF deck I sent you because there's a bunch of good stuff in here.
Okay.
Okay, so why does Dr. Birx trust the CDC? We're going to break this down into the stuff we're going to cover on this pre-show. We've only got a few minutes left, but when we get over to the patron-only hour on Patreon and Subscribestar, I have a study that was done in 2005. And we're going to look at this study. It's the American Medical Association published it. And it's a study about the impact of influenza vaccinations on mortality in elderly people. And results of this study are about as creepy as anything that you've ever read. So we're going to read this in the patron-only hour. I've got a copy of it. You've got a copy of it. We're going to review this. This is from 2005, American Medical Association. Mega tip of the hat to Cheryl Atkins. I found this while listening to one of her podcasts, and I'm not going to tell you guys which one because I want you to listen to every one of them.
She's great.
She's amazing.
Yeah.
So I think she's awesome. So she did a podcast that I'm listening to where she covers this. And I went back and got the document, and we're going to review this in our patron-only hour because this is stunning. And this is from research that Cheryl did back in 2009 on the H1N1 pandemic then. She was knee-deep in it back then, researching that, and has some amazing breaks from that story, from the H1N1 story and what was happening in the States. So I encourage the audience to look into some of her research, listen to her podcast. I'm a huge fan of hers. So,
but John, I don't think we can talk about this study without reminding people that in 2005, there was an article in Science magazine that's basically it's linked to right here on the CDC's own website, where they're talking about how they deliberately reconstructed the 1918 influenza pandemic virus. So that's pretty interesting.
And I'm making another video right now. I'm working on a new video that going to pick up where we left off. I published a video, I think it was back in May, called Finally John Cullen is a Dead Man Again. And from the title, you've got no idea what the hell's going on in there. But the net of that video is that Dr. Fauci and the team resurrected H1N1 in 2005 at Walter Reed. And so I'm taking that story and building on that because in 2005, some other stuff happened. And this is the other thing we're going to talk in our patron-only hour tonight is back in March of this year, there's a guy in Philadelphia who has a radio show called Chris Stiegel, Stiegall, I guess it's Stiegel. Mm-hmm. And he's on the radio in Philadelphia, and he had Dr. Fauci on the show. And I've got some clips from Dr. Fauci on the Chris Stiegel radio show back in March talking about and answering the question, what would you do, Dr. Fauci, if one of your patients had it? Would you prescribe hydroxychloroquine? And so we're going to listen to Dr. Fauci's response to that and Dr. Fauci's response to how does this compare to the H1N1 outbreak in 2009. So I've got those audio clips queued up. We're going to look at this research paper from the American Medical Association, and that's what we're doing in our patron-only hour. So for those of you who are interested in the impact of influenza vaccinations on mortality on the elderly, this is crazy. And the fact that Cheryl couldn't get this published on CBS.
Not surprising.
This is a fascinating story. Yeah, it's important that you guys hear this. So for those of you who are not familiar with this, we're digging in tonight. We're going to listen to the Chris Stiegel show coming out of Philadelphia, interviewing Dr. Fauci 5 months ago, March 24th. Okay. April, May, June, July, August, 5 months ago. And sometimes it's important to go back and to listen to the things that Dr. Fauci was saying back in March, right? And that's what we're going to do. We got a bunch of clips queued up. So that's Patreon only. We have 1 minute to show people where we stand because the numbers are sick. Can you go to the PDF and we'll wrap up on that?
Sure. And then what I want to do is just take a minute
page.
to get you on a different VPN connection because we've got a big delay here. But here we go.
Sure. All right, let's go to the next page. Yep. Just page down. Okay. We're looking at daily reported deaths. How many people are dying per day in the United States? And the trend is down. All right. And it's been continuing downward. Now, this show broke the fact that it had been heading down for months. And we broke that on the 4th of July. And on the 5th of July, it started to go up. Okay. So we reported that valley and we called the low on July the 4th, and we were right. And then we had that second hump. But since the second hump, it's been going down, and that's great news. Let's go one more page down in the deck, and then we're going to have to go to our patron-only hour. All right, this is where we stand right now. Coronavirus compared to influenza in the United States. Both viruses, although members of different trees in the virus world, experienced a double hump. Both had an outbreak at the same weeks, and the curves follow each other. Remarkable, given that these are two different species.
Yeah. Now, we had an email from a viewer who had said that there was something about this that he didn't agree with. Did you have a chance to look at that?
Now, I can't figure out his point. The net of this chart, and what people should be taking away from this chart, is that there are weeks where blue is bigger than the green, and there's weeks where the green is bigger than the blue. And what that means is that neither the blue or the green can include the other. Because if it did, the blue would always be bigger than the green. If the influenza, which is the blue, included, then it would always have to be bigger because it would have all the COVID numbers and the influenza numbers in it. So it'd have to be bigger. It's not. And the same is true with the COVID numbers. There are weeks there in between in that valley near the 4th of July where you see that influenza deaths started to, there were more of them than COVID deaths. So once again, right, so they overtook COVID deaths in the valley. So that was around 4th of July. We had more influenza deaths. And we do now, too. If you look in the most recent weeks, we've got more influenza deaths in the last 2-3 weeks. Yeah, so there's more blue than green. So they can't include the other. The green can't include the blue if it's less than the blue, and the blue can't include the green if the blue is less than the green. So that's data logic for you, and that's why they pay me the big money at Oracle 30 years ago. All right, let's move on. Next slide. And then
okay. One more slide, and then we'll go to the, because I really want to get you on another VPN.
All right, 236,000. This is a number. 236,000 people are dead from PNI, according to the CDC's mortality database. The same one we keep checking. It just keeps going up and up and up. Now, the coronavirus numbers are about 170,000, 180,000 right now, according to the Johns Hopkins database. According to CDC, it's 167, but that's, again, death certificates. But 236,000 people from H1N1 or from influenza PNI is a spectacular number. And now when you combine these two, we have over 400,000 dead. Is that the real story? Are they double counting? I can't tell you. I don't know if we really have 400,000 people dead or we have 236,000 people. That's the part I can't tell you right now. Are we double counting? Are these discrete deaths? Are there 400,000 people dead or not? And so I think this is part of why Dr. Birx can't trust anything coming from the CDC. You look at these reports, you hear some of the things that Dr. Fauci's about to say, these things I've got queued up. It's no wonder Dr. Birx doesn't trust anything coming out of the CDC.
Yeah. Well, let's break for now. People are going to be able to join us in just 5 minutes on patreon.com/IamJohnCullen, subscribestar.com, I am John Cullen, and subscribestar.com/crowdsourcethetruth or patreon.com/crowdsourcethetruth. I want to thank all the sponsors who make this show possible and remind everybody that this is the way you really should want your information. I don't want, information that's paid for by some pharmaceutical company that wants to convince you of something having to do with their product. We've heard from Robert Kennedy Jr. that even though he had a lifelong friendship with Roger Ailes, they would never let him on to Fox News to discuss his information. So this is a great way for people to make sure they are unbound by corporate sponsors. John, I'll see you in just a few minutes over there on Patreon and Subscribestar. Thanks for watching, everybody.